Afternoon. We're going to open with a quick prayer. Lord, thank you once again for another day to wake up in the morning and just be able to breathe and get out of bed. We take that for granted sometimes. Also, I pray we exalt you in everything we do. No matter the circumstances, no matter what trials we're going through, we will always put you first, and that is the one thing that truly matters. Be with anyone out there struggling with any sort of addiction or anything else that has been affecting them in negative ways. Help people who are trying to come out of the ashes. These things we ask in thy name. Amen. All right, so today's video, we're going to be discussing meth withdrawal. Now, I'm doing this because I got a comment a while back that I just saw on a video, and it reminded me of an experience in the psychiatric hospital, because it was a similar example where, a patient would come and be like, I really want to quit meth, but I just don't know how to. I don't know how to quit meth. It's one of those things where there's not any approved treatments yet. There's not an effective treatment for it yet either. But the good news with that is, if you are wanting to quit, you've already won half the battle of it. Because that's the first change. That's the first part of the conversion that has to happen in order to quit any drug, but in particular, meth. Now, the second part of the equation can be a little tricky, but what is sobriety to you? Meaning, I believe in medication-assisted therapy, and also there are people who don't do well with taking medications. I also believe that there need to be more medications that are approved or even off-label prescribed for people going through specific sorts of withdrawal, in particular methamphetamine withdrawal. Once again, there are no approved treatments right now by the FDA stating anything as being safe and effective. However, I did find a study, and I've covered it in another video, but I found another study in particular about how Vyvanse, which is an amphetamine, or even something like amphetamine extended release tablets, or capsules, my bad. But I believe amphetamine instant release could potentially help as well, showing that it was a study where I think it was like 12 to 15 people went into the setting and had to stay in the setting for it was like 100 plus days. Now, one or two of them left the study. They didn't want to continue, but the rest of them stayed, and the overall results were pretty astounding. It was showing that somebody going through methamphetamine withdrawal or being diagnosed with methamphetamine use disorder, it showed that Vyvanse was a treatment that, taking it in low doses, not long-term but short-term, to get off of methamphetamine, and in particular going through that acute withdrawal and some of the post-acute withdrawal, was shown to be effective. In follow-ups to it as well, showing that there was the relapse rate, there was one person who relapsed and the rest of them did not. But one did leave early and discontinued the treatment. My point to this being is, I believe today doctors and just healthcare providers in general should be a little bit more open to listening to somebody going through something like methamphetamine withdrawal. I know we know, for example, about heroin or fentanyl withdrawal. We have treatments for it. And once again, some of those can be risky and can cause addictions in themselves, but they're also treatments that work extremely well. For somebody suffering with methamphetamine withdrawal, sometimes, they go through that initial withdrawal, and they're going through the sweating. They haven't slept in days. And I know I've gotten a comment in the past saying that, oh no, once you get past the sleeping, you're good. That's bull. Maybe for you, but for a lot of people, that post-acute withdrawal is very tough, extremely tough, actually. I truly do, just feel bad. Not feel bad, but I feel for somebody going through a drug addiction or, for example, methamphetamine withdrawal, because it's like they come into the hospital, they essentially just let them detox, and then they go, and there are things such as Wellbutrin that do help. Don't get me wrong, they do help, but it's not for everyone. It's not something even approved for methamphetamine use disorder, but it can help. It can help with depression. It can help sometimes with a mood lift as well. Don't get me wrong, but outside of that, though, an SSRI sometimes. But a lot of times, some of those medications have side effects within that cause further problems and, unfortunately, a relapse. Now, I know there will be people that are in the recovery community that a lot of times are completely anti-medication, that it's, if you go follow the steps, if you go through recovery, that will work. I agree. I think AA and NA are amazing ideas for a lot of people and work. I've seen, I know in particular firsthand how powerful it is for some people, for family in general. It's amazing. But once again, it's not for everyone. Some people, they could use that as a tool, but then they sometimes need other tools with that. Some people need medication. Some people even need, and this, don't get mad at me for saying this, please. Just because you've went through an addiction, fentanyl withdrawal, meth withdrawal, it's not the end of the world to be prescribed a controlled substance. For example, if you're going through fentanyl withdrawal, they prescribe Suboxone. If you're going through methamphetamine withdrawal and you're having serious anxiety that's not being resolved, maybe having a PRN of a low dose of a benzo might help. Or, having a doctor that would feel comfortable prescribing you off-label a low dose of something like Vyvanse. Because at the end of the day, everyone is slightly different. Their brain chemistry is a little different. And I'm not trying to say that it's appropriate in every situation for somebody to be prescribed, if they're going through meth withdrawal, a controlled substance. I'm just saying there needs to be more openness to it, because let's be honest, the fentanyl, the heroin, it's all getting stronger out there today. I don't know about you, but I know firsthand what I've seen in ERs and stuff now today, or even in the psychiatric hospitals. Everything is laced with fentanyl, and it's getting harder and harder and harder for people to come off of these things, and it's just getting worse. Look at PCP. I'll link a video at the very end to a PCP psychosis and whatnot. I mean, it's getting worse and worse. But I wanted to let you know, if you are going through methamphetamine withdrawal real quick, that if you are wanting to quit, don't be discouraged. That is the first part that I would say of the conversion of stopping the substance, okay? That's the first part. If you relapse, use that as a tool to learn from, okay? The second aspect of it, if you've went through the withdrawal over and over and over again and you're relapsing, it might be uncomfortable, but tell somebody about it. Or if you have a doctor, tell them what's going on, that you're wanting to stop, but you just don't have anything. You've tried AA, you've tried NA. You might need a medication to the side of that. Let them know. Ask them in general about, have you read anything about any prescribed medications or treatments for methamphetamine withdrawal? Little things like this. If you're proactive with your doctor, they will be more willing to work with you, okay? The worst thing you can do is, okay, you quit meth, then you go to something else like fentanyl or heroin, and you end up overdosing, okay? Talk to somebody about it if you can. But I just wanted to raise some hope out there. And also, use those tools if you have them available of AA and NA. There's even online meetings if you really, if you're serious about stopping, there is free access to tools. Okay? Use those tools. Talk to people about what's going on. No one's there to judge you about it. They're all in that together, We're all in that together. So just in general, just know that first off, you're not alone, and also your situation, it's not obviously anyone else's situation, but you can go through life together with someone, with a group of people, and also if you need medication, that should be an option to you. And also, if there's any medical professionals out here listening, doctors in particular, start raising awareness about this, because, there's no treatment for it, but methamphetamine use disorder is a huge problem, just like fentanyl. It's a huge problem in its own. I know, for example, in the Midwest and Independence, it's like one of the it's always leading top numbers in meth labs in the United States. Okay? For example, I live in the Midwest. That's why I say that. But just know that if you are wanting to quit, that's the first step. And also with that, when you're going through the withdrawal, the initial withdrawal, just remember that's your body's way, even though you're suffering and going through that pain, those stomach cramps, not sleeping. You might be thinking you're seeing things. Just in general, the cold sweats, the mood swings in the initial withdrawal and the post-acute, that's your body's way of thanking you and detoxifying from that. I know it might sound a little like, how's that? That's what your body thanking you. It's pushing that out, that chemical. It's pushing it out of your body. Okay? It's pushing it out of your body. Long term, when you look back on it, which you will get clean, you watching this, if you are using, or if you know somebody, let them know. Let them know about the channel, that there is hope. Or just let them know if they're going through, if whatever withdrawal they're going through, let them know if they're wanting to stop, that's the first step. They're halfway there. A lot of people don't ever get to that part where they want to change for themselves. That's the biggest thing. If you have that draw, that you're wanting to get better, and you keep falling back into that cycle, that vicious cycle of addiction, it's tough, but that's a good thing. You're wanting to stop. Unfortunately, people trying to put people in rehab, if they're not wanting to do it themselves, or they're not wanting to stop something, or you're taking it from them, they're going to relapse. Okay? So just know that. Just know that if you're wanting to stop, that's 50% of it. Okay, that's today's video. I just wanted to do a real quick video about just in general methamphetamine withdrawal in particular, because I feel for a lot of these people, because there are no approved treatments for them. And there are slowly but surely studies coming out. So if you've tried multiple things, you're not having luck, talk to your doctor about potentially and once again, not condoning it, I'm not giving any resources, I'm just reading studies. Ask your doctor what they would think about, you've been taking something that's such a dopamine rush to your brain, methamphetamine, 100 to 1,000 times stronger, like rush of dopamine than really even something like an amphetamine or like a runner's high. That ask him, could this potentially be a long-term solution because I'm struggling? Or, something if you have potentially even ADD. I read another study about a lot of people who abuse methamphetamine in particular. One of the big problems is they were never, and this is for women out there as well. I'm going to talk real quick about the ladies out there. Women, ladies, if right now ADD has went very underdetected in women throughout, it's just now starting to be brought up. Men were overdiagnosed. Women were not being diagnosed, and it's been shown that a lot of women who suffer from methamphetamine use disorder, unfortunately, they didn't get properly diagnosed with ADD, and they end up using methamphetamine for the first time, and this can go for men too, or they end up using a street stimulant, and they're getting relief from that initially, and it's actually causing them to sleep. Yeah, you didn't think about that, did you? There are people who initially start using methamphetamine, smoking it, I'm not talking about shooting it, who are using it to calm their mind, and they're sleeping at first. It's a lifesaver drug for them because they were not properly diagnosed with ADD. Okay? I just wanted to throw that out there as well. But just hang in there, hang strong, talk to your doctor, talk to someone else about it. Love you all. That's today's video. I'm going to be covering once again 7-OH that's in kratom, or that's not in kratom. It's like a subset of kratom, but it's not kratom itself, and how that is causing a lot of concern in the kratom community. I'm not for or against kratom, as stated in other videos, but it's causing a lot of concern because it does have severe addiction potential and withdrawal in general, and it's very hard to get off of. So look out for that in the future. I love you all. Just stay strong.